Well, let's see if we can't save you some money here on your health care this morning. Craig Gusson joins us here, and we try to unravel some of the complications of health care reform and so on. And really, all people want to know in the end is, am I covered? Can I go to the doctor? And how much is it going to cost me?
Exactly.
So we're going to break it down a little more simply for folks today.
Yeah, that's exactly it. And with the new laws coming and the new benefits coming, one of the things you want to do is you want to look at your plan and say, okay, what do I have today? And what am I willing to give up to save some money? One of the reasons that we're now hearing that the rates are low in covered California was because they're using what they call a narrow network, which means if you have a PPO plan, you could probably see 95% of the doctors out there. Now you may only be able to see 50% because only those are in the narrow network, which means they're getting a reduced fee, so they can the insurance companies can reduce the cost. HMO is the same way. So the question is your doctor still in the network? If he or she is, then maybe you look at the narrow network to save some money. Maybe go with a little bit higher deductible. Depending how much money you make. If you make less than $2,000 a month, you're going to get some real good subsidies that maybe it's going to cost you less than $57 a month to get a health insurance plan, which is the silver plan. No deductible, $3 doctor visits instead of $45. No deductible versus $2,000. And your max out of pocket is only, I think, $2,000 versus $5,400.
Well, most folks used to just, go to the office and they'd get a couple of options on things to sign up for, and they'd sign up for a plan, and they were pretty good with that. But now, with more and more employers dropping coverage and finding ways to not offer coverage because it's an added expense to them, folks need help doing this. So do you go to a health insurance broker, much the same as you'd go to an auto insurance broker now?
Exactly what you're doing. I recommend go to somebody, especially somebody I think belongs to the San Diego Association of Health Underwriters. These are mostly health insurance agents. They are also going to have to take between 8 and 12 hours of educational class given by Covered California to even be able to sell the exchange product. Those people will be able to tell you what subsidies are, what's in the exchange, what's outside the exchange. Because remember, Cigna, United Healthcare, and Aetna are not going to be in the exchange. They may offer products outside the exchange that may be a lot less costly and a little bit better benefits. We don't know yet. But if you talk to somebody who does health insurance on a full-time basis, you're going to get better information and you're going to get educated on which way to go and how can I save some money and keep my costs down.
See, now we talked about this colonoscopy that I had recently, and why there was I have an HMO, and yet there was a $500 copay that I had to make on that, and I just didn't understand that. And they finally explained, well, if you're doing it because there's symptoms that require the doctor to send you to then it's $500. But if it's just routine, it's free.
However, if it's routine and it's free, and during the colonoscopy they find a polyp, all of a sudden it's not free anymore.
And then it might be $500.
Then it might be.
So there's all these little things that, if you're getting to be a certain age when these certain diagnostic tests are just routine and recommended, you need to really understand which of them are paid for, which are not paid for, and again, that's very specialized, as opposed to somebody who's in their 20s, just maybe getting out of college, striking out on their own, maybe married, having their first child. I mean, totally different situation.
It is, and the biggest complaint I've had from clients is the colonoscopy issue, where they say, hey, I went in for my routine colonoscopy and it was supposed to be free, and all of a sudden I got this bill. Well, they found a polyp in there, and I think that's unfair. That you're going in, you're told it's free, and then at the end of the day you got to pay all this money. And I think,
and they've already been where the sun doesn't shine, and it's a little too late for to go back and say, well, never mind.
Right.
Yeah.
And there's nothing wrong. And the polyp's fine. And there's nothing there. So it's some of the issues that you got to be aware of. And the best way is to get an education. I've spent the last 12 months learning everything about the new healthcare law and everything that my clients need to know, so that I can explain to them, look, here's what's going to happen when you have a colonoscopy. So they know, yes, it's supposed to be free, however, it could cost me some money. So there's not a big surprise. And you're not spending money that you didn't plan on spending.
And again, folks, we just mentioned that as an example. I mean, there are thousands of examples that apply to you. So you might want to get in touch with somebody like Craig Gusson, an health insurance expert, and walk you through what you've got now and then what's coming down the line in the future.
Exactly.
Craig, thanks for coming in.
My pleasure.
As always. All right.